So Medicare Advantage is a hot topic as this past open enrollment, over half of all seniors have enrolled in a Medicare Advantage plan, and that's only going to grow as more and more time passes. At least that's what the trend predicts. But is Medicare Advantage really that bad? If you watch this channel, you say that my bias really is going to say that it is. And there is new laws that have been passed that go into effect next year in 2024 that should alleviate some of the problems. But that doesn't mean that's all going away, and it doesn't mean that it's getting any better. And in today's video, I'll go over some articles that have come out as well as what CMS is doing to try and make Medicare Advantage a little bit, I guess you call it, less fraudulent. All right, so in this article, this came out in January 2023. Feds expect to collect $4.7 billion in fraud penalties from insurance companies. Now, this is definitely a good thing for the federal government, but it's a bad thing as this tends to happen all the time, and it continues to happen, and I'll show you right here. This is the list as of May 10th of penalties that are consistently going on that CMS has to regulate and then charge different insurance companies for penalties, civil penalties against insurance companies, and pretty much everything in between, penalties and just straight out fraud, misdiagnosis, etc. And right here, all of these are not only fraud, but overbilling, whistleblowing, and US government proven fraud. And all of these companies, these are not the only companies, but these are the top 10 companies that have been found fraudulent, and they're organized by size. So it's not that United Health Group had the most fraud, it's just that they have the highest population of Medicare Advantage members in the country. And these are as of, I believe, 2018. So you can see it is pretty bad. And what exactly are they caused or being charged of? A lot of it has to do with overbilling and upcharging. So when a Medicare Advantage member joins a plan, they have certain diagnoses, and those diagnoses make the plan member worth more to the insurance company. The insurance company, let's take United Healthcare for example, gains a per member per month dollar amount for each member, and across all the members, if they reach a certain risk score and performance score, they get more money. And they can get bonuses at the end of the year. It's all some complex pricing, reward, incentive model. But for Medicare, and what they're really getting hit for is having too many diagnoses that are unsupported. And it could be that Medicare beneficiaries aren't going often enough to support these medical diagnosis, because after a certain amount of years, if the member doesn't show up at the doctor's office, they don't have medical documentation, then the diagnoses are no longer valid. So that could be part of it. But what has been happening is that there's unsupported documentation, which, if you know, in the medical field is not good. So what happens? They find all this unsupported documentation and they charge the insurance company. And that is what has been happening here. Now that's the one side of Medicare Advantage fraud and penalties. The other side is the prior authorization rules and requirements that have been passed for 2024. This part is going to get better for the members, right? Most members don't really care about all this fraud that's going on behind the scenes. That might dwindle away at the trust fund, but it's not going to really hurt your benefits, but or maybe the free plans and all that other stuff, gym memberships. But what is hurting the members is the millions of prior authorizations that are denied and the delay in care. This ruling here is going to go into effect for all Medicare Advantage plans and Part D drug plans, and it's going to have hopefully better outcomes as far as giving care. Currently, the rules go, those things, how they determine care isn't going to change. They have to have a really good and thought out guidelines and rules. Currently, they just have to have rules and guidelines. They don't have to meet certain standards, or at least that's the way what it seems like, because the new rules state here, when coverage criteria not fully met established by Medicare statute, organization may create publicly accessible internal coverage criteria that are based on currently evidence that is widely used. Currently, if you look, you can't find anywhere where these companies get their prior authorization medical guidelines. So that's an improvement. So at least that way now we can see what's happening. Also, they have to establish utilization management committees to make sure that it's consistent. They can't say this one gets it, this one doesn't. It has to be relatively consistent when they're giving out care. That way they have a set algorithm on how care is given, not just this one's more expensive than this one, so we're not going to give it. Also, the continuance of care is now 90 days. So if in December you get authorization for hip surgery, the new plan has to give you 90 days, or at least as long as it's medically necessary for you to get this procedure when you switch plans, which is something that in the old days, now, right, 2023, is not possible. So really consider when you're getting into these Medicare Advantage plans, all these kinds of things that could happen because it's happening. So if you want the freedom and flexibility, you have to pay more for those services. It only makes sense. How could you pay less and get more? This is a closed medical system. There's no way really that you could pay less and get more unless you're losing out in some other way. And typically that other way for Medicare Advantage is that, number one, what we said in the beginning of the video, the Medicare Advantage companies are charging the federal government more than what they're supposed to. And number two, they're restricting care from those who really need it. And that's why they can give healthier individuals more flashy benefits like gym memberships and dental, and withhold more life-saving, critical, expensive care from other beneficiaries, which I'm not saying they're doing it, but that's what it appears. And you can bypass all that by staying on the original Medicare A and B program and buying a Medicare supplement plan, which doesn't do prior authorizations unless it's required by Part A and B, and you can't get around for that. And that's really only very intense surgeries, not like, where Medicare Advantage, you might need a prior authorization for a referral or for a mammogram or for a colonoscopy. The original Medicare program, as long as your doctor says you meet criteria, you go get one. So just keep those things in mind when you're shopping around for a Medicare plan. Additionally, I have been reminded through my own family member being diagnosed with cancer. If cancer is something that concerns you, there are cancer policies that provide you with money that you can use to not only pay for your care, but to have someone help you, have somebody take you around, have somebody, take off work so that they can take you to your doctor's appointments, right? Because those things take time and money. And not just to say, hey, here's some money, just to really be considerate of those things, or to pay for a caregiver, to pay for rides. Those types of things can add up, and a cancer policy that might give you like $10,000 or $20,000 to help you transition or to help you with those expenses might be something that would help. Those things aren't too expensive, and if you really think about it, if you do have that episode, it might be really beneficial. I personally have one. If you are interested, do let me know. I will leave my contact information in the comments below or in the description below. I hope you guys have a great day. Remember, it's not just about zero premium per month. It's about the benefits that you get. Check out my book for a Medicare Advantage Survivor Guide. If you are stuck on the Medicare Advantage program and you need to choose the best plan that's best fit for you, it is available on Amazon Kindle. If you have Kindle Unlimited, you can read it for free. If not, you can get the hard copy book. I think it's $10 on Amazon. And I'll see you guys in the next video.